The affirmative stated that the United States government should mandate free healthcare for all of its citizens. We will show that there is no possible way for the United States to provide free healthcare for its citizens without having to pay for services based on Encyclopedia Britannica's definition of free, meaning not costing any money, and Webster's definition stating not costing or changing anything. On case arguments, the affirmative referred to free and universal as the same type of healthcare. They also refer to the universal healthcare as coverage in which all people have access to the health services they need, when and where they need them without financial hardship. However, this is from the World Health Organization, who focuses on world health and not strictly the United States. The World Health Organization goes on to state that countries with fragile health systems focus on technical assistance to build national institutions and service to delay, fill critical gaps and emergencies. In more robust health system settings, such as the United States, we drive public health impact towards health coverage for all through policy dialogue for the system of future and strategic support to improve performance. The affirmative did not uphold the resolution because their definition of free healthcare was not specific in reference to the United States, and they obliged it with universal healthcare, leading to confusion throughout the debate. On topicality, the affirmative resolution was that all citizens should have free healthcare. They conclude with stating that all citizens should have free healthcare, but leave out free. They then went on to call this free healthcare universal healthcare, and such suggests a single-payer system such as Canada, thoroughly confusing many issues. Finally, the affirmative ends by stating bluntly that it would cost Americans higher taxes to implement such systems. On disadvantages, healthcare is not free anywhere. Without heavy taxation, no government can carry the burden of free healthcare. It would be an advantage to those who are already able to get medical care they need to suddenly be shifted into a system where they, like many Canadians who can afford it, then go out the country for care that they desire. The motivation for innovation in products and services from desire to for-profit, removing that by standardizing costs and services tends to greatly reduce innovation. On critiques, free healthcare is not sustainable by the United States and therefore does not solve the need for healthcare reform. The need to expand the reach and educate would come with less resistance from a system that has been in place for so long rather than a drastic change. As stated in Masterclass, the existing system will only tolerate so much change at a time. Trying to do too much at once can be counterproductive. The majority of Americans had health care that would fall in the line of universal health care even before the Affordable Care Act. Most retired people had insurance through medicine, while most working Americans had insurance through their employer, and Americans at or below the poverty line were eligible for insurance through medical service members, and their families had eligibility for health care through the VA system. Overhauling the complete system at a great expense would result in a decline in care and further resistance from those who are already getting the health care they need. Our focus needs to be on expanding the research of assistance and education to those that are not now serviced. On counterplan, it is our position that the mixed healthcare system of the United States currently provides universal healthcare for several identifiable populations, and that additional modifications could be made without enormous cost. What we suggest is continuation of current efforts to progressively shrink the group of people with some sort of governmental subsidized healthcare access rather than blanket it with universal healthcare that would never actually be free. We can shrink this group without overturning the system that exists. We have done so most recently with Obamacare. We can also make the current system far more effective and efficient without dismantling it, and without reducing the range of quality of care currently available to force the same kind of quality care for everyone. Public education must improve with respect to diabetes, respect to diabetes prevention and treatment, obesity, importance of exercise for children and adults, as well as wellness in the population at large without dismantling the existing system that we currently have. The National Library of Medicine states details to primitive measures lessen the costs associated with uninjured and unhealthy population, investing $10 per person annually in community-based programs aimed at encouraging physical activity, poor nutrition, and smoking in the U.S. could save more than $16 billion annually within 5 years, equaling a return of $5.60 for every dollar spent. Another recent analysis suggests that if 18% more of U.S. elementary school children participated in 25 minutes of physical activity 3 times per week, saving attributed medical costs and productivity would amount to $21.9 billion US over their lifetime. Change does not need to be revolutionary. We think current political and social cultural systems can handle the changes we suggest, though it will take time and careful consideration since resources are limited. Nothing is ever free.